and I want to thank you, Joe, for your leadership in putting together this letter to make our position clear. And I stand here with my distinguished colleagues and in strong opposition to the Senate Finance Committee's proposed 40% excise tax on high-cost insurance plans. Because while this tax may be intended to target insurers, real-life experience demonstrates that the cost of this tax will simply be passed on to insurance payers who are ordinary working families, if indeed the plans continue at all. In these challenging economic times, our middle-class families cannot be asked to carry the burden of extra taxes or higher premiums while large insurance companies continue to make record profits. If insurance costs continue to rise at the projected rate, an increasing number of insurance plans covering middle-class families may be subject to the proposed 40% excise tax. That's why we're out here. Furthermore, this tax will unfairly impact workers in high-risk professions. This includes our emergency responders, firefighters, and police, who need strong benefits to protect themselves and their families from potentially crippling medical costs. Members of the labor community and other drivers of Ohio's economy have spent decades negotiating for fair health benefits. These individuals have often traded salary or wage increases to secure strong health benefits. We cannot in good conscience just add to these families' economic burdens. We must not lose sight of our goal of reducing health care costs for all Americans. We have to be fair. Enacting this excise tax is a wrong step in the wrong direction. And as I continue to work to provide quality, affordable health coverage for Americans with my colleagues, I and they will continue to oppose measures that raise health care costs for families in Ohio and across the nation. Thank you again, Joe, for your leadership. And next is Maisie Hirono.
Oh, thank you. I represent Hawaii, and I'm here to join my colleagues, those who signed this letter, and those of us who are here to really bring home the fact that this is a tax that is going to do three things. It's going to hit three groups very hard. Middle-class families, as my colleagues have already talked about. It'll hit unions, union plans and union members, and small businesses. The reason that my colleagues have already talked about the impact on middle-class families, and really one of the major goals of health reform is to make health care more affordable for middle-class families, and the impact of this excise tax is going to fall very hard on those very families we're trying to help. Let me turn briefly to small businesses. Small businesses are going to get hit by this excise tax because being small, they're not in a very good bargaining position vis-a-vis the insurance company, so they end up paying more for their employers or employees' insurance, so they're going to be faced with this tax. I particularly want to emphasize how this is going to be very bad for the union negotiated plans and therefore union employees. Give you a specific example. In Hawaii, these government employees already pay about $500 a month for their portion of health insurance for a family plan. They've recently seen an increase of almost 24% in their health insurance, and because of Hawaii's economic situation, the governor has said you state government employees are going to bear the full brunt of this 24% increase in your insurance. This is for somebody who's already paying $500 as her share, his or her share of the plan. So now, already I'm hearing stories such as a single mother who has given up her insurance plan. She works for government. She cannot afford this 24% increase. She's giving up her plan. Her two children are now being covered by Medicaid, and her greatest fear is that she's going to get sick and without health care. So this kind of an excise tax is only going to exacerbate that situation. We're going to hear even more stories like that. So now I'd like to turn to my colleague, Shelley Berkeley from Nevada.
Thank you. And before I introduce Harold Shakeberger, who's the head of the Firefighters Union, I just wanted to make a couple of comments. I represent Las Vegas, which is a working town, and it is a union town. My union reps negotiate every 5 years for a union contract for almost every employee on the Las Vegas Strip. We're talking about hundreds of thousands of employees in the Las Vegas Valley that work within one industry. They sacrifice wages in order to get good health benefits. We should not turn around and tax those health benefits. We made a promise during the campaigns that we would not impact middle-income Americans by continuing to tax them disproportionately. This proposal would do just that. So I am opposed to it on moral grounds. I'm opposed to it on economic grounds. I do not believe it will be in the final version, but I think it's very important for members of Congress to stand up and be counted that we're opposed to this method of paying for health care reform. And I thank you very much. And Harold, let me introduce you now.
Well, listen, I don't want to step out in front of my great representatives.
You just voted, you go next.
Listen, first of all, I want to extend on behalf of 300,000 professional firefighters and emergency medical professionals that I have the privilege of representing. Joe, Congressman Courtney, I want to thank you very much for your leadership. The members that are here with you today who have signed on to this letter, and the other 150 members that recognize that, simply put, this is a bad idea. This is nothing more than a tax and placing the burden of trying to pass a health care proposal on the back of the middle class and workers like firefighters that I represent. You know, they call this the Cadillac plans, and I can tell you that this proposal, an excise tax, isn't about just affecting those that work for Goldman Sachs at the top of the economic ladder. This would affect firefighters all across this nation and other middle-class workers, those that drive Ford F-150s and Chevrolets. This isn't a Cadillac plan, but a good medical plans that we have negotiated over the years. And as Representative Sutton said, we have sacrificed along the way wages and many other benefits to try to put into place the kind of medical coverage that America's first responders need to do and be protected and to have the kind of care and the tough, dangerous work they do. We believe that the way to pay for this plan is exactly what was included in H.R. 3200 or what was proposed by President Obama. And that is a surcharge of those at the very top of the economic ladder that's been getting the tax breaks and putting the money in their pockets for the last 6 years ought to be able to step up to the plate and pay their share that can pay for most of the cost of this plan, or to limit the deductions on those, again, at the very top of the economic ladder. I think it is a mistake, and it is wrong that this will be nothing more than a pass-through to workers. There's no way that this will not be ultimately borne in one of two ways: either higher costs for Americans' middle-class workers or less benefits from those plans that will try to diminish their plans to stay under the limitations. So I applaud the members of the House who have signed on this letter, shown the leadership, and certainly we're going to be doing everything we can to support their effort and see that this is not included in any final version. Thank you.